Welcome to this Beyond Zero e-learning module that will cover an approach for clinicians on patients on ARVs not adhering to treatment. This is Module 3 of 3 modules and will help clinicians with a structure to support poorly adherent patients in formulating a treatment plan to improve adherence. In Module 1, we explored how we as clinicians can strengthen or weaken our patients' capacity to take treatment. In Module 2, we presented a practical approach to help our patient identify the obstacles in engaging with the treatment plan. In Module 3, we are putting it all together using the principles of change management in helping your patient towards better adherence. The model of improvement is outlined by Edward Deming and used in the behavioral science of change management is used widely to improve healthcare delivery systems, but it can also be applied in helping our patients change their behavior. When we are expecting our patients to take treatment regularly, keep healthy, and show up for their appointments, we are expecting them to change what and how they do things. Whenever we are counseling or advising our patients, we have an underlying expectation of change. Yet change is not easy, as any person will tell you that has ever needed to complete a simple course of antibiotics. The framework that we are going to use in change management for this particular case is simple and easy to understand. Step 1, establish a clear and compelling goal. Step 2, find the vital behavior needed for the change. And step 3, engage 6 sources of influence to support the behavior change. I want to apply these 3 steps to a consultation with a patient who is biologically failing and where adherence to treatment is an issue. As outlined in Module 2, Step 1 is setting a goal. And the biggest mistake that we make as healthcare professionals is that we set the goals for our patient. The patient is told that the goal of his treatment is a suppressed viral load. But perhaps a suppressed viral load is not that important for your patient. It now becomes essential to understand your patient's health beliefs as outlined in Module 1 and 2. What are their dreams and hopes for the future? The goal should be identified by the patient in their own words. You can help by asking questions such as, what do you want your health to be like 1 year from now? If they have vague comments such as, I just want to be healthy, you can ask them how they would know that they are healthy. What is their definition or understanding of health? As outlined in Module 1 and 2, most of our patients want to get better and want to be healthy. And we simply need to support them with the information and the treatment they need to achieve their own treatment goals. Write their goal in big, bold letters in the patient handheld notes. Step 2. We now need to find those 1 or 2 vital behaviors that need to change to help our patient meet their goal. This is the most difficult step as we often address the wrong issues. If you and your patient do not understand the root cause of their difficulty in taking treatment, you cannot find the key obstacles that need to be addressed. Module 2 of this e-learning series contains a worksheet that you can use to help your patient identify obstacles to adherence using Joseph Grenny's 6 areas of influence. See the notes below for a link to the worksheet as well as the module. Once you have established where the main obstacles for your patient lie, you and your patient need to brainstorm the 1 or 2 key behaviors that will make all the difference. Is this an ability issue or a motivation issue? Does the patient need more education and training, or do we need to find a better social support network? Find specific interventions that are within the sphere of control of you and your patient and that your patient believes will be of benefit. Step 3. Once you have identified which specific things you are going to address, you can now look at as many different ways of supporting that specific intervention or behavior. Use again the 6 areas of influence to see how you can strengthen a specific change in behavior on a personal level, on a social level, or on a structural level. So at the end of your session, you should be able to write down a clear, compelling goal, the root causes that have led to the challenges in adherence, and most importantly, the 1 or 2 vital interventions, as well as the ways in which those are going to be strengthened. Let us quickly look at 2 different case scenarios as examples using this approach. Our first case is a 23-year-old girl, Thandi, from a rural village in Mbashe. She lives with her aunt, who is a well-respected local traditional healer. She is 1 year on treatment and has never had a suppressed viral load. The CD4 count is 84, and she has recently had a full course of TB treatment. So how did a treatment plan develop for Thandi? The first step was helping her find her own compelling goal. And this is what she came to. I want to pick up weight and be able to walk up the hill to our house without having to stop all the time. I want to feel strong. Using the worksheet as outlined in Module 2, we discover that her aunt is an important person in her life, but is unaware of Thandi's HIV status, although she does know about the TB. The aunt has told her that the TB has been caused by a curse, and once a month Thandi goes through a ritual 3 days of purging. She is frightened by the curse, and she believes that this has also caused her HIV. But she also wants treatment to kill the virus before her aunt finds out. By listening and staying objective and non-judgmental, we are able to discuss possible changes Thandi can make. Firstly, everything here hinges on the relationship with her aunt, and engaging the aunt is a positive force in her life. She not only needs to disclose to the aunt, but also needs to clarify with her aunt her views on ARVs. But we also need to strengthen Thandi's self-efficacy to take personal responsibility for taking her treatment. By using the 6 influences as a structure, we identify some specific actions that can support these vital behaviors. On the level of personal motivation, we are engaging positively with Thandi. This increases Thandi's personal motivation to take treatment and to become virally suppressed. On the level of social motivation, Thandi has helped to identify a community healthcare worker in her community whom she trusts and who knows her aunt well. She gives you permission to contact the community healthcare worker and to arrange for her to visit Thandi and her aunt and help with disclosure. Structural ability. You can give Thandi tips on taking the ARVs in the afternoon on those days that she purge, at least 2 to 4 hours before, to ensure that the treatment has been absorbed. Our next case is a boy called Jacob, who is a young, angry 17-year-old who attends a local urban government boarding school. He has been on ARVs for 12 years and has been on second line for 18 months now and have not yet suppressed. He is passive-aggressive in the consultation and shrugs to most questions. He has been referred to you for virological failure. You managed to convince him to work through the worksheet and help identify issues that might be affecting his adherence. So step 1 is helping Jacob find his own compelling goal, and this is what you come to. I want to live a normal life like my friends. I want to have girlfriends and drink and party like everyone else. I don't want to have to watch what I eat or worry about getting sick. Using our worksheet, we try and help identify the root causes with Jacob. We discover that Jacob does not want the kids at school to know his status. He has no privacy at the boarding school and lives in a large dormitory. He keeps his treatment in his locker hidden away, but does not want to carry it with him. When he comes back late from school events, he therefore does not want to take his treatment. He's annoyed at having to take tablets twice a day. He initially wanted to be on only the one tablet. So now to identify the vital behaviors that need to change. Through discussion of ARVs and clearing up some misconceptions, it becomes clear that if Jacob had a normal viral load, he could pretty much lead a normal life. The challenge is how to take the ARVs regularly in a very public boarding school setting. Jacob needs support, both practically and emotionally. So let us apply our areas of influence. On the personal level, by giving Jacob information about ARVs, HIV transmission, and the reason he is on second line, we are able to increase his motivation to get his viral load suppressed and to lead a life like any other young boy. You give him an opportunity to discuss his questions and worries around sexuality and HIV. On a social level, you brainstorm possible support structures and he identifies his games teacher as someone he trusts and can go and talk to. The teacher could possibly help with keeping his medication for him on school trips. Structural, you look at clever ways of disguising the tablets, and he comes up with the idea of keeping it in his sunglass holder. You also look at ways of making things easier by reassuring him that the tablets does not have to be taken exactly 12 hours apart, and looking at a fixed dose combination of the AZT and lamivudine. As you can see from these two case illustrations that obstacles to adherence are never easy to resolve, but using a blanket approach with all your patients have very little chance of success. By helping patients come up with their own solutions in a structured way increases their self-efficacy and help both the clinician and the patient find ways to increase the ability and motivation to take treatment. Thank you for joining us. Please see the notes section for more information on other modules and downloadable free resources.